Wow. Oh, it already went.
Oh,
Wow.
Oh my gosh, that's exactly why I came here today. Ooh.
It was crazy, right? I'm delighted to have Salwa in today. And I met you probably 3 or 4 months ago, right?
Mm-hmm.
And you were here with your partner.
Mm-hmm.
And we did his craniofacial
Yeah.
release. But we didn't do a video with him, did we?
We did not.
No. But we are going to do a video today. And what week pregnancy are you in?
I'm 32 weeks and 2 days.
Okay, 32 weeks and 2 days to be specific. And for people that don't know, generally for humans, because I also work with animals, but for humans it's based on a 40-week term for pregnancy. And it doesn't mean you have to have a baby in exactly 40 weeks, but that's the ballpark that where all the estimates are based on. So at 32 weeks, you're getting close. And what have they told you? Once you get to 35 weeks or 36 weeks, it could happen at any time at that point.
Yeah, I'm having twins, so 38, my OB has considered them safe to. We would like them to stay in there until then.
Okay.
Yeah.
So 38 weeks would be
At least.
a great milestone.
Yeah,
Right?
for sure.
Really nice. And what was some of the reason that you wanted to work today? Like, what are some of your goals? What have you been feeling while you walk, sit, move around? Give us a little update on how you're doing.
I'm actually doing a lot better than I thought I would be doing, looking back, thankfully. But it's mostly like they're getting heavier, so it's like my hips, a lot on my left, and like kind of groin and like lower back for sure. So I'm starting to wear like a belt for support because it's just getting heavier. But it's mostly like hips and especially on the left side.
Do you know anything, or are you allowed to tell us what type of boy, girl, or
We're
is it a
waiting.
secret?
We're waiting.
Okay,
Yeah. So I
okay,
don't
that's
know.
good. If she doesn't know, I don't know.
Yeah.
Just like to ask because I'm
Yeah.
sure people in the comments are curious. So we're all waiting then. We're just going to wait and see. And how about things like, have you had any edema or swelling in the ankles, the feet,
No.
the hands, carpal tunnel, anything like that?
No.
Any other complications or problems that we should know about?
No.
Okay, good. All those are good, healthy things.
Yeah.
And what type of exercise or self-help have you been doing during this pregnancy?
Yeah, I've been able to move my body all like minus the first trimester, which like was slowly destroying me, but I do my prenatal workouts, strength training, a lot of walking. Like today I walked for my doctor, which was in like East 80th down here, and I feel great. I mean, I'm tired a little bit, but yeah.
And how much
Most of that.
weight has your body changed during pregnancy?
Like numbers?
Yeah.
I don't ever look because
Okay.
I feel
All
like
right.
it's none of
That
my
was
business.
a bad question, and it's none of my business.
So I don't know.
So the question is, do we cut that out in editing so I don't look like such a horrible person, or do we leave that in because people enjoy when I make mistakes? So I'm sorry, but sometimes
it's
people
fine.
like to go, I've already gained 25 pounds, or
Yeah.
I've felt the shift. I've never had this weight on me before,
Yeah.
and we use it just to talk clinically to talk of how much it's pulling on the lower back.
Sure.
How is that? Oh gosh. All right. So we're gonna get started. Anything else you want to share before we get jumping in?
No, I'm excited.
All right.
Yeah.
Let's get going. Look at this funny thing. So this is a pregnancy pillow. I bought it on a massage site. I'm not promoting that. They're not affiliate of mine. I'm just talking about it. I keep it for when someone comes in. Now, one interesting thing was when I was in chiropractic school, there was this kind of extended certification program that I could do called Chiropractic Pregnancy Certification. And my ex-wife said, I think you should do that course. And I was like, I don't think I should do it. It's extra money and I'm burnt out. I've been at school for 4 years. I really don't want to do it. She goes, I think you should do it. So she won that argument.
Yes.
And I did it, and it was the best thing I did. Because since then, since I graduated in 1998, so since 25 years, I've been working with anywhere between 3 and 5 pregnant women a week for 25 years. The other thing I learned, some people, or you can go up on YouTube and look at it, but there's a technique called the Webster breech turning technique or Webster turning technique.
Yeah.
And I actually studied with Dr. Webster while he was still alive because he was on campus for those months during my certification. So I learned how to do the Webster breech turning technique from Dr. Webster himself because it's taught now all over the world.
Yeah.
But he was my mentor for that. And I've probably turned 25 to 30 babies over the last 25 years and twins also before also. So
I will be back for that.
anyway, so the best way to get on this is you're going to start here and then you're going to dive down into it, okay? And you might be happy to be on this because you probably haven't been on your belly in this way in a while,
Oh
right?
my God, no, I miss it.
Does this feel good?
Feels fantastic.
And I think we hear that all the time. We'll hear someone that gets on this. We had someone already this week on this that says, I haven't been on my belly like this in a long time. It feels good, right?
It feels so nice.
Good.
I need one of these.
So one of the things I like to do, and it's actually part of the Webster technique, is we bring the ankles up and we check for symmetry here. So right now I don't feel symmetry. But here's this heel, the right heel, and I can have it touch. In this one, it doesn't want to go all the way.
My
And
left side.
Can you feel that, Salwa?
I can, yes.
Yeah. And what that typically means, it can mean a lot of things, but what Dr. Webster used to teach us is to look to see if the sacrum needs to be balanced. And when the sacrum is not balanced, it's very hard to have an easy delivery. So delivery might be longer labor time. It could be more uncomfortable, or what they call back labor, where you get back pain during labor. And so it's really nice to balance out the sacrum. And you could feel it if I come in here. Do you feel that?
It's really tense.
Yeah.
Yeah.
I don't have the perfect statistics, so please forgive me. Again, the study was being done on campus when I was a student there, but they basically looked at pregnant women that got adjusted during pregnancy, and then a group of women that didn't get adjusted during pregnancy, and there was a shorter labor time. It was almost 30 or 40% less labor time. So for example, let's say the average labor time is 6 hours. The group that got adjusted had like 4 hours or 3.5 hours. So it reduces labor time to balance out the back, the pelvis, the sacrum, just in general. And over the years, over the last 25 years of working with pregnant women, I've worked with pregnant women right up to their due date, to literally the due date. I had this one woman, Olga, who was such a blast. She would come in like this. Here, look at me for a second, Salwa. She would come in like limping, and she goes, my hip's out. So I get her on the table and I work on her, get her hip back in, and then she'd walk out normal. And then she was in labor on week 40. She was in labor and she was heading to the hospital to give birth. And her husband was coming from a different direction to meet her there. And she was in an Uber, and she pulled over in the Uber and came into my office. And she goes, I need you to adjust me. I'm going into labor, and we had 2 people on the tables, and I said, does everybody mind just letting me work on? And they said, of course not. So we get her on. I popped the hip back in. She went down to the Uber, went to the hospital, and gave birth a couple hours later. But she didn't want to go finish the childbirth with the hip out. So that was the closest to labor time that I ever did an adjustment on someone. So do you feel this spot I'm working on? So while I'm talking, I'm just working on this spot. And now I'm going to do a little bit in L5 as well, because that's connected to the sacrum. And you could feel this muscle now, right?
Mm-hmm. Oh my gosh, I feel it every day.
Right there. One thing I don't like to use on pregnant women, especially for this area of their body, is the hypervolt or the Theragun. I might do it up here. I might do it up here, but I don't want to put in any extra vibration into a developing baby. We don't know for sure if that would be harmful. So I don't recommend that. So people watching, even if the back is tight, I won't do hypervolt or Theragun massagers in this area. Before I adjust it, I want to do a little tap with this instrument here, and here, and here. And may I touch the bottom of your pelvis?
Sure.
So this is the sits bone, but the real name is ischial tuberosity. And then I'm going to do the sacrotuberous ligament and then come into the fossa of the ilium. Now, we'll do bigger stuff in a minute, but let's just see the change already. So by me rubbing out the sacrum, releasing L5, and using the gentle adjusting instrument, I'm able to get both heels to touch. Do you feel that?
I do, yeah.
I don't think it's perfect yet because this one still feels a little tighter.
But it's better.
But I moved to 2 inches. So now I'm going to come up here into the shoulder blades with my thumbs, and you probably just get tight here from just life, right?
Yeah.
Now this is almost too cushiony to adjust. Oh, it just popped. Did you hear it?
Mm-hmm.
So it did pop. Ooh, that was loud. Did you hear that? Did it feel good?
Felt great.
Good. All right, let me do this hip a little bit. Right in there. Do you feel that spot? Mm-hmm. Let's do your hamstrings, calves. Do your feet get achy?
Yeah. I asked my partner to massage them.
Good. Ooh, I just cracked it. And I'm in this area now. You can feel how tight that is, right? So we're going to get that in a second. So the next thing I'm going to have you do is reset. Now lie on your back.
Okay.
And I can help you too. But just try your best and I'll support you. There you go. I want to get here on the ankle first.
Ooh.
Wow. Did you hear that?
Yeah. Oh, that was nice.
Yeah, I just felt like they were a little compressed. Ooh.
Yeah.
All right, so now we have a few things to do, okay? So I want to release your upper back first.
Okay.
So I'm going to crisscross your arms. Okay. Take a breath in, and blow it out. Little one, you feel that one? And here's the next one. Big breath in, and blow it out. That one went.
Yeah.
So one of the ways that I work around the belly, if you could come around the side for a second, you'll see. If she wasn't pregnant, I would just probably be right on top. So my body weight's going through my hand. But because I don't want to put any pressure on her belly, I lean forward, which is a little stressful for my shoulders. So they wouldn't teach this to do normally every day. But it's a safe way to get her back without, there it went again. So I got another good one without me putting any pressure on her belly. So you have to make modifications to protect her. So now we're going to release your neck next.
Ooh. Oh, there was so much right there.
It was crazy, right?
Oh, I need a second. Yeah, that was crazy. Oh, that was nice. Oh, wow.
So that's what you needed.
That was good. I didn't even know.
Yeah.
I didn't really feel a lot of tension there, I guess. But now that you've done that, I feel a lot better.
Good.
Ooh. Oh.
I'm going to do a little bit more for that left sacrum.
Okay.
Remember, I got it pretty well, but we both felt like it wasn't just right. It was still a little stiff on that side. Mm-hmm. But I got the range of motion, but it wasn't a fluid range of motion. It was still a little boggy or stiff. Or
Sure.
Big breath in and blow it out. Oh, it already went.
Oh,
Wow.
Oh my gosh, that's exactly why I came here today. Because I feel that, oh my gosh, wow.
That was such a big pop. That actually startled me because it was so loud.
Yeah, that was great.
Big breath in and blow it out. Wow. That's the one.
Ooh,
Both sides, right?
both, yeah.
How was that?
That was great.
Good.
Lovely.
Let's check things like wrists.
Okay.
Thumb. Those are good. Let's try this one. Here it goes. Thumb.
Yeah.
Thumb. That's it. And we're just going to check the range of motion like we started with the heels coming up towards the buttocks. And remember, we had it pretty good, but I just want to see if it's more fluid now.
Oh yeah, I can feel it.
You see it. They come up even too. Nice and loose. So before it was like this. And now it's nice.
Yeah, it's so different.
Yeah. And when you're ready, come stand up.
Oh, wow, I feel like lighter.
Good.
Yeah. Because I can feel the pressure pretty constantly, especially if I've been moving a bit, especially my left. Am I taller?
Well,
I feel a little taller.
maybe I'm short.
In maybe it's internally. I feel.
You're so much taller.
I just grew up.
No, but
Yeah.
that's good.
Oh wow,
Now,
that is so
can
nice.
you like bend this way and see what it feels like, or bend back? Should be looser, right?
Yeah, this is everything. It feels great. I feel fantastic.
Okay, good. So awesome.
Thank you.
Thank you for
I'll be back,
for
obviously.
also, trusting the
Yeah.
process, because it's scary when you're pregnant to let anybody work on you, and so thank you.
Yeah, of course. Yeah.
Yeah.
Thank you.
All right, thanks everyone.
Thank you.
Please leave her a wonderful comment encouraging her love and happiness and health.
Ooh. Oh, there was so much right there.
It was crazy, right?